our students are doing a great job. I know it's affecting your socialization. I know it's affecting your, in some cases, your productivity. It's affecting your mental health, all of these things. But you are resilient and you continue to strive on. We are in week 7. There are a lot of people who were questioning whether or not we would make it past week 2. We're in week 7. We're past Labor Day. We're past week 6. We're in great shape. And if we can keep this up, we're going all the way to November 24th. This is a great week. The numbers are down once again. We did not have a post-Labor Day spike as predicted. I was wrong. I'm happy to be wrong. It's one of the few times in my career I think it's good being wrong. We need to do more numbers on the sentinel testing though, because unfortunately the number of people who've volunteered or showed up for sentinel testing has been low. The number of people who've been chosen that have declined has been high. That does not help the process of sentinel testing. The purpose of sentinel testing, again, is to discover if we may have an underlying spread that could potentially lead to an outbreak, and our ability to identify that early so that we can mitigate those situations. Without that information, we're kind of flying in the dark a little bit. So we don't want to do that. We really want people to sign up, volunteer, and if you are chosen, to please show up, because it will give us, again, an early warning sign that we can potentially get on top of and mitigate and prevent an outbreak. I gotta say, what a great job I think the students did in the stadium, as well as athletics, in being able to execute the first football game. Of course, the football team and the coach and staff did a great job by giving us a win. But really what was important was that people adhered to the instructions of when and how to enter the stadium, doing the health check in advance, and then staying amongst your social bubble group. So your social bubble group being the people who you live with or people who you consistently socialize with was very helpful, because again, that's going to limit the spread of the virus. What I learned is why she is in charge of the White House Task Force. She is incredibly articulate, very intelligent, and knew her data and information very clearly. What did we take away? A few things. Number one, despite a change in the Auburn decision on the mask order, she again highly encourages that we wear masks indoors and outdoors consistently, because that's going to be the strategy even with or without a vaccine for at least the next year or more. One of the topics that came up with Dr. Burks that she was very big on, and I supported that, is the whole concept of antibody testing. So first of all, we're going to have a group of people that had the disease, tested positive, and I encourage anyone in that situation to please get a hold of those test results and keep them handy. Then there's going to be another group who may have had the disease, may have had symptoms, and therefore, but couldn't get tested or decided not to get tested. I encourage those people to go ahead and get an antibody test. Then there's a third group of people who would have had a significant exposure. So it could have been a close friend, a family member, people in the household, a roommate, all those who were positive, and you were exposed to those people. You may have had, like 40% or more of people, an asymptomatic situation. And the only way that we may be able to tell if you had the disease is to do a blood test for antibody. So I encourage those people to go ahead and get that, because it will give you some level of comfort that you had the disease. It will also give us some level of knowledge of what is the prevalence of the disease in the Auburn University community. You can get that testing through the AU Medical Clinic by calling 334-844-9825 and telling them that you want to get antibody tested. But just a reminder, antibody testing is not a way to diagnose a present or an acute infection. It's a way to diagnose whether or not you've had a previous infection, especially for those who did not test positive around the time that you may have been exposed. Because we've had people who, again, were exposed, may have tested twice but came up negative. But along the way, they may have picked up that infection, they just had no symptoms. So encourage antibody testing. I think it was the right time for us to definitely expand the size of events so that we can have more face-to-face and in-person events. Clearly, the numbers supported that. But that does not mean that we don't continue to take our own personal accountability for the steps that we need to take to protect ourselves as well as others, such as, again, wearing masks, sanitizing your hands, trying to maintain your distance whenever possible, and adhering to the regulations on the size of the groups. Want to encourage again people to go out and get your flu shots. In fact, the clinic are having some on-campus flu clinics starting tomorrow, 10 a.m. to 2 p.m. in the Student Center. I think it's room 2326 right next to Chick-fil-A. This is the ideal time for you to go ahead and get a flu shot. Again, remember the symptoms of the flu and the symptoms of COVID overlap. So if you can get your flu shot now, that will help create some immunity against the flu in our population. So get your flu shot.